In this third and final episode of a three-part series on your options for managing pain during labor, you are going to learn about epidurals. Welcome to the All About Pregnancy and Birth podcast. If you're having a baby in the hospital, you are giving birth in a system that too often takes away power from women over what happens in their own bodies. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OBGYN who's had the privilege of helping well over 1,000 babies into this world. I've been a doctor for over 20 years, and I'm here to help you take back your power, advocate for yourself, and have the beautiful pregnancy and birth that you deserve. This podcast is for educational purposes only, and it's not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hello there. Welcome to another episode of the podcast. Whether this is your first time listening or you have listened before, you know I am so glad you are spending some time with me today. This is the third episode in a three-part series of episodes on your options for managing pain during labor. The first episode was about medication-free techniques, and the second episode was about medications that are not an epidural, specifically opioid medications and nitrous oxide. And even if you plan to get an epidural, be sure to go back and listen to those other two episodes, because there will be a period of time when you have pain during labor, but you don't have that epidural yet. So you will need to know some strategies and options for managing pain until you can get an epidural. So go back and listen to those two episodes. Now, the only way to know about these shorter episodes that I release on Thursdays is to subscribe to the podcast. So wherever you're listening to me right now, be sure to hit that subscribe button, because that's the only way you're going to know about these short episodes. I don't share them on email or social media. So subscribe to the podcast right now. Also, you can get all of this information in a free guide that you can download, so you don't have to worry about taking notes or anything. I've created this guide that gives all the information, also gives some pictures as well. Obviously, I can't share pictures on the podcast, and it also gives you questions you want to ask your doctor, or you will want to ask your doctor about the pain management options that are available to you. You can grab that free guide at drnicolerankins.com/pain. The last thing I want to tell you about before we get into epidurals is just remember that there's no right way to manage pain during labor. It is very much so a personal choice, one that you have to make for yourself. Today, there's a lot about natural birth, and the natural birth movement is kind of growing. When natural, people mean unmedicated, because really all birth is natural. But unmedicated birth has become more and more popular. But if you want an epidural, that is totally fine and the right decision for you. That's a decision that you have to make for yourself. No one else can make it for you. Social media can't make it for you. Your friends, your mom, your sister. This is your personal choice. And whatever choice you make about managing pain in labor is the right choice for you. So let's talk about epidurals. Epidurals work by decreasing most sensation, including pain. So it's not just that your pain level will be decreased. You won't feel a lot of anything from a certain level down when you have an epidural. It decreases all sensation. The way that an epidural works is that a catheter is placed in what is the outermost part of the spinal canal. That's called the epidural space. And by putting that catheter there, it allows for repeated administration of pain medicine. So what that means is that with that catheter there, you can keep getting doses of pain medicine, or you can get a continuous infusion of medication that is hooked to a pump. How various hospitals manage epidurals is dependent on the hospital and the anesthesiologist. But the big picture is that you will continue to get pain relief that is going to last for the duration of your labor, no matter how long your labor is, whether that is a few hours or even a couple of days. The epidural will last all of that time. Now, epidurals, contrary to popular belief, can be given at any point during labor. I've seen the full gamut. I've seen women who've gotten an epidural at 2 centimeters. You can even get an epidural at 10 centimeters. That's when you're completely dilated. That is not as common to get them at 10 centimeters dilation, but it can be done. And there's also no rule that you have to be a certain number of centimeters dilated before you get an epidural. You can get an epidural whenever you want an epidural. It is not about however many centimeters dilated you are. It's when you are ready to have that type of pain relief. Do be mindful that epidurals do take some time to set up. It does not happen right away. There's generally about 30 minutes of preparation or so before you even get the epidural. And then once you get the epidural, it takes about 20 to 25 minutes for the pain relief to kick in. There are also some circumstances where women cannot get an epidural. If you have issues with your platelets are what helps your blood clot. If they're too low, then you cannot safely get an epidural, because without those platelets being at the right number, it puts you at risk of developing a blood clot around the spine in that epidural space that can be potentially very dangerous. Also, if there's something different about your anatomy, so if you had scoliosis or if you've had surgery on your back, if you have any sort of hardware in your back, then you may not be able to get an epidural. So definitely if you have scoliosis or you've had back surgery and you think you want an epidural, do mention that to your doctor for sure so we can plan accordingly. We can often do an anesthesia consult during your pregnancy to decide if you can or can't get an epidural. And then that way you can plan for how you're going to manage pain if you can't get an epidural. So if you have any issues with your back, do mention it to your doctor and specifically bring up that you would like to talk to an anesthesiologist during the pregnancy to know whether or not you can or cannot get an epidural. So also contrary to popular belief, epidurals do not increase your risk of C-section. When you look at the research studies, that just is not the case, that epidurals increase your risk of C-section. Epidurals do, however, increase your risk of having what's called an assisted vaginal birth with either using a vacuum or forceps. And that's related to the fact that if you have an epidural and you're not feeling as much, then it may be harder for you to push because you can't feel the right place to push, and then you end up pushing longer. The risk of that is not very high. It's only a slightly increased risk, but you do need to be aware of that risk. Epidurals will slow down labor a bit. That is true that epidurals will slow down labor a bit, but it is only by a short amount. Studies show that epidurals slow down labor by maybe about 30 minutes or so. So an epidural is not going to significantly slow down your labor, and it's definitely not going to stop your labor. One thing I want to talk about is walking epidurals. You may have heard about walking epidurals, where you are able to get up and move around with an epidural. Walking epidural is really a misnomer because you will not have enough sensation in your legs to stand up and walk and support yourself with an epidural in place. Let's talk about something most pregnant women aren't getting enough of: omega-3 DHA. The recommendation is over 200 milligrams a day, but less than 5% of pregnant women in the US meet that. That's one of the reasons I love Ritual's Essential Prenatal. It has 350 milligrams of vegan DHA plus other key nutrients like methylated folate and choline to support baby's neural tube development. As an OBGYN, I appreciate that Ritual goes beyond the basics. The formula is science-backed, third-party tested for heavy metals and microbes, and every ingredient is traceable. And the delayed release design, it's gentle on the stomach, something that really matters, especially if there's trouble with nausea during pregnancy. You deserve to know exactly what you're putting into your body, especially when it comes to prenatal multivitamins. And with Ritual's dedication to traceable science and sourcing, you always will. See for yourself with 25% off your first month at ritual.com/Dr. Nicole. Start Ritual or add Essential Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off your first month. Now, the anesthesiologist can decrease the dose of the medication so you're not as completely dead numb. We can try and tailor it a bit. And when I say we, I mean the anesthesiologist, because they're the ones who place the epidurals and control the epidurals. So we can tweak it so you're feeling some things, but not everything. The ideal epidural is when you have pain relief for your belly, for the contractions, which you're going to experience in your belly, but you still have some motion in your legs, so you're able to move around and get in different positions. We really don't want you to be completely numb. We don't want you to be in a place where you don't feel anything at all, because if that's the case, when it comes time to push, it's very difficult to push when you can't feel anything and you have no feedback as to whether or not you're pushing in the right place. So do not expect that if you have an epidural that you're going to feel dead numb or not feel anything at all. Some people are surprised by that or even upset by that if they feel anything with an epidural. But you really actually want to feel some sensation so you can have an idea of the right place to focus when you push. If you find that when you push and you have an epidural, you can ask the nurse to decrease the dose when it's time to push, or she may just do that on her own, because again, you want to feel something. And go into the epidural with that mindset that you are going to have a decreased sensation of pain, and not necessarily that you're not going to feel anything at all, or you never feel a single contraction or a single bit of pain, because that's not the reality. And that's not what's most ideal in order to help you effectively push your baby out. Let's get into some of the side effects of epidurals. The most common side effect is itching, and it can actually be pretty intense itching. Epidurals can also cause some nausea and sometimes vomiting in people. A really sort of odd side effect of epidurals that we don't completely understand why it happens is shivering. And it's a very, very intense shivering, even though you're not cold and you can't control this shivering. Oddly enough, sticking your tongue out stops the shivering. I know it sounds crazy, but sticking your tongue out will stop the shivering. You obviously can't just sit there with your tongue stuck out all the time, but if the shivering is really annoying, you can stick out your tongue for short periods to help decrease it. Typically, it's going to be more so in the beginning, and the shivering settles down, so you can stick out your tongue, the shivering will decrease. We don't know exactly why that works either. Another potential side effect of epidurals is they can cause a drop in your blood pressure. And when your blood pressure drops, then the blood flow to your uterus can drop. And when the blood flow to your uterus drops, that can affect your baby's heart rate. That's typically going to happen, that drop in blood pressure, right after the epidural is first placed. That's why you have to get a bolus of IV fluids, through your IV, in order to help prevent your blood pressure from dropping. And if your blood pressure does drop after you get an epidural and your baby's heart rate drops as a result, then the fix is to fix your blood pressure, which will then fix your baby's heart rate. Another potential side effect that can happen is headaches. Some people can get a pretty intense headache from an epidural. That may not show up until a day or so afterwards, or sometimes even longer afterwards. There are some fixes for that. One is called a blood patch, something that anesthesiologists do, but headaches are a potential side effect of epidurals. Epidurals can also temporarily reduce the effectiveness of breastfeeding. It's short term and it gets better pretty quickly with time, but epidurals surrounding the immediate part after birth can slightly decrease the effectiveness of breastfeeding. It may be a little bit more challenging. Now, another sort of side effect or risk of epidurals is that they may need to be replaced. So sometimes they don't last the duration. The catheter moves, something happens, the catheter gets bent, and it may need to be replaced during the course of labor. Sometimes it needs to be replaced more than once. Epidurals can also be one-sided, where you get more relief on one side than the other. And then another possibility, and this is something that people are not always prepared for, and it's rare, epidurals may not work at all. I've seen in a handful of people where epidural gets placed and then it gets replaced, and it never really works very effectively. So those are potential side effects, that it doesn't work at all, it's one-sided, or it needs to be replaced. I don't want to scare you off from epidurals by telling you about all of these things, but know that epidurals are the biggest intervention in terms of managing pain during labor. And with a bigger intervention, there are going to be more potential side effects. These things don't happen very commonly, but you do need to be aware of those potential issues that may occur with an epidural. Now, for some pros of an epidural, number one is that epidurals provide excellent pain relief. There is nothing better in terms of, or stronger in terms of providing pain relief during labor than a good epidural. There's no getting around that. The medications that are IV medications or nitrous oxide, they're just not going to work as well. A great epidural will give you excellent pain relief during labor. Another pro is that an epidural should last up until birth. So whenever you get it, that catheter is still there. You get that continuous administration of medicine, so it's going to last the duration. The epidural can also be used for a C-section if needed. If it comes to it, you get a big dose of medicine through that catheter, and it will work during a C-section for pain relief as well. Also, very little medicine from the epidural reaches the baby. The medicine really stays in around your spinal cord, so very little medicine reaches the baby, whereas the opioid medications that I talked about in the last episode, they will reach the baby. Your baby does clear those opioid medications from their system, but that is a possibility, unlike with epidurals. So for some of the cons of having an epidural, you are going to be pretty tethered in place, for lack of a better word. There's a lot of stuff that you're connected to. You will have an IV. You have to have an IV when you get an epidural because you need those fluids ahead of time to prevent your blood pressure from dropping. You also have to keep getting IV fluids. Another con is that you cannot feel the sensation of using the bathroom with an epidural, because remember I said it doesn't just decrease pain, it decreases all sensation from a certain level down. And if you can't feel the sensation to empty your bladder, then there's a risk that your bladder overfills. You don't want that to happen, because if your bladder overfills, then it forgets how to empty itself potentially. So that can be a big problem. So in order to keep your bladder from overfilling, you have to get a catheter that stays in place, or every 2 or 3 hours, your nurse has to empty your bladder with a catheter. You are, for the most part, confined to the bed with an epidural. Walking epidurals, again, are a misnomer. I've never, ever seen that anybody do it or really achieve that. Also, epidurals do require you to have continuous fetal monitoring. Baby has to be on the monitor at all times with an epidural, whereas for an unmedicated birth or nitrous oxide, you can have intermittent fetal monitoring. And then epidurals do take some time and preparation. Again, it's anywhere from 20 to 30 minutes to get everything set up, get the fluids you need ahead of time, and to get the anesthesiologist there. That's a conservative estimate. It could be longer. The other thing is that epidurals are considered elective. They're not something that's like an emergency. So the anesthesiologist may not be in the hospital 24/7 to place an epidural, depending on your hospital. Not all hospitals have anesthesiologists there. The anesthesiologist may have to come in from home, so that's going to add some additional time. Also, the anesthesiologist may have other things going on. So the anesthesiologist is generally going to be responsible for all of the anesthesia procedures in the hospital. So if there are trauma surgeries that are happening or urgent cases that are happening, those are going to take precedence over an epidural, because an epidural is considered elective. And then the final con is, and I mentioned this before, you may push a bit longer than if you didn't have an epidural, and that goes back to having that decreased sensation and not being able to feel things. Okay, so there you have it about epidurals. Remember to subscribe to the podcast wherever you are listening to me right now, so you never miss these short episodes. Do grab the free guide on all of your options to managing pain in labor, drnicolerankins.com/pain, and hop on over to the gram and let me know what you think about this episode or any episode. I am on Instagram at Dr. Nicole Rankins, and my DMs are open. So that's it for this episode. Do come on back next week, and remember that you deserve a beautiful pregnancy and birth.
Well, I'll be a hitchhiker in an Easter Bunny costume. Hop in. Where you headed?
BJ's Wholesale Club to do my Easter shopping. I have so many baskets to fill.
That costume is so lifelike. There's not even a zipper.
Oh, there's BJ's. I can hop out here.
Look at him go.
Get a $15 digital coupon when you spend $150 on practically anything in one transaction through April 20th. Coupon will appear in your digital gallery on April 24th. Terms apply. Go to bjs.com/Easter coupon for details. BJ's. Absurdly simple savings.